Well, there were millions of Americans who had no access to health care because they didn't have health insurance. What's your health plan?
Listen, providing more access, we could have done without taking control of the entire healthcare system. When you look at Obamacare, it's a perfect example of what Washington does. It's a one-size-fits-all approach for the whole country, all driven by Washington bureaucrats. I bet they've hired tens of thousands of people between the IRS and over at Health and Human Services just to run this. All the decisions, all the rules decided by Washington. We have a wide, diverse country. And I just think it's time for us to look at this differently. For those who don't have access to affordable health insurance, helping those at the bottom, I think we're all for. But we don't need Washington to ruin the best healthcare delivery system the world's ever known.
So how do you do it? What's the Republican health care plan?
We're working on this, having discussions amongst our members. We got a lot of divergent views about how best to go back to a doctor-patient relationship that's revered, about rewarding medical professionals as opposed to all those rules that are coming down and frankly driving doctors out of the system.
But you know, this is one of the criticisms that a lot of Americans have, that the Republican Party knows what it's against, but can't tell us what it's for. Can't tell us the details, for example, of a health care plan after all these years of Obamacare.
Scott, with all due respect to you, you mischaracterized the likelihood of success with Obamacare. The Congressional Budget Office doesn't work for Republicans or Democrats, run by a former Clinton staffer, said that the best case scenario, Obamacare reduces the number of uninsured from 40 million to 30 million. A 2,700-page bill that wreaks havoc with the private health insurance market, and in the end, doesn't get everybody covered in the first place. Now, that is not my view of how to improve the American healthcare delivery system. If we had the ability to do it, we ought to pull it out root and branch and start over. The chances of that happening with Barack Obama of Obamacare in the White House is slim, but we're going to make the effort.
You don't have an alternative.
Why wouldn't we allow the states to run their own exchanges? Why wouldn't we allow the American people to buy across state lines, where they could buy policies that fit their needs, not a policy designed by Washington? Why wouldn't we allow small employers to group together so they can buy health insurance for their employees, just like big unions and big businesses can? There are a lot of things that we can do. How about the issue of medical malpractice? And it's just not about the insurance cost for doctors. It's the other cost. And the other cost are doctors are ordering up to 25 to 30% of the tests they order only to cover their rear ends from a lawsuit, driving up the cost. Medical malpractice reform would help lower the cost of health insurance and lower the cost of health care in America for all Americans.